We started as a 50-50 funding partnership, and it continues to steadily decline over the years. The federal share of healthcare expenses is now down to just 22%. We need to address the declining federal share to restore and maintain it at 35% of the ever-rising costs.
Just give us the money. That's the message from Canada's premiers to the federal government. Amid a national healthcare crisis, the premiers are demanding increased funding with no strings attached and a meeting with the Prime Minister.
Do we need more funding? Absolutely. We need the federal government to set a date early this year, coming up, sometime in January, and nothing should be more important to the Prime Minister than meeting with the 13 premiers. That's the bottom line.
But some provinces are sitting on billions in unspent cash. In July, Ontario's Financial Accountability Office found that province spent $1.8 billion less on health than budgeted. BC is sitting on a $6 billion surplus, and by law, if it's not spent, it'll go to paying off debt. Alberta has a $12.3 billion surplus and has already said that money will go to debt. Premiers couldn't explain why the federal government, already in deficit spending, should rack up further debts.
You know, for Ontario, we had a small surplus, but I can assure you, with the healthcare spending and the money we're putting into healthcare, we're looking at a deficit next year, the following year, and the following year.
I think I heard a characterization of crying poor or whatever the case may be, but I think what we're asking for as premiers is for our partner on this, the federal government, to step up and do their part.
We know that we need to work together to make it better. The federal government is committed to doing that. And yes, that does mean some more investment, but it also means a focus on being sure we get the results that Canadians quite rightly expect of us from those investments.
Federal Health Minister Jean-Yves Duclos has pointed out that his government already plans to increase the health transfer 10% next year, but wants provinces and territories to share key health indicators. Some provinces are believed to be open to the idea, but others consider it a total non-starter. Manitoba Premier Heather Stephenson suggesting this is the federal government trying to make provinces accountable to Ottawa.
I think it's an issue of accountability. We're accountable every day to people within our jurisdictions, and we'll continue to be accountable to them.
In Ottawa, Shally Lee, City News.